Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Logan St, a palliative medicine physician at Terrebonne General Palliative and Supportive Care. Welcome to the show, Dr. St.
Thank you so much, Rhonda. It's good to be back.
Good to have you. Well, let's dive into today's conversation about understanding palliative care. The first question I need to ask you is explain what is palliative care and how does it differ from hospice care?
That's such a good question. So what I tell my patients is that palliative care is a subspecialty of medicine that focuses on helping both patients and their families get relief from the symptoms and stress that come along with serious illness. So anyone who has a serious diagnosis, whether that's cancer related or related to a heart or lung condition, often they have symptoms that come along with that illness that affect their daily life. And they're also navigating a lot of medical decisions and their life is changing at home. And we want to help them and their families figure out how to take the best care of them throughout that time. This is very different from hospice. While hospice also deals with patients that have a serious diagnosis, hospice care is specialized care that's really designed to support families that have a patient who's nearing the end of life. So if a patient is within around the last 6 months of their life, then we think about hospice care so that the family has an extra layer of support at home. But palliative care isn't at all specific to the end of life phase. I have a lot of patients who may even be being treated with curative intent for a cancer, but they have a serious illness that is giving them symptoms and is affecting their daily life. And so we can still really help them navigate that.
Okay, so who can benefit from this type of care and what kind of illnesses should think about receiving this kind of care?
Anyone who has a serious diagnosis that leaves them feeling overwhelmed or with a heavy burden of symptoms, I think it's worthwhile to consider a visit. So often we'll talk through what they're experiencing at home. I mentioned some of my patients might have cancer. So are they having cancer-related pain? Are they having nausea or vomiting, either related to the cancer or the treatments they're receiving, right? Another example would be patients with a heart or lung condition. Often those leave patients feeling short of breath, with low energy. And I see a lot of patients that whenever they get short of breath, that could make anybody anxious, right? So then they're dealing with anxiety attacks because no one's managed their shortness of breath, right? Not to mention that anyone with a serious illness, often it can affect your mood because you might be stuck inside if you're not feeling good. You're dealing with a ton of appointments. Mood affects sleep, it affects how you eat, all those things. So they're all related. And so if we can really get to the bottom of what's making patients less comfortable at home, we can be helpful.
And when in the illness process should they start to receive this kind of care?
Yeah, I think often because palliative care is a relatively newer subspecialty, I think even some physicians have the mistaken understanding that we're for patients that are closer to the end of life. But really anyone who we could help with symptom management upstream, or if their disease is changing and they're navigating treatment decisions, or if their caregiver is overwhelmed at home, those are all things that we can help with far before they reach an end of life stage. So I think it's always worth considering a consult whenever you have somebody whose disease is impacting their daily function, even if it's really early in the disease course, or if it's not a terminal disease. They should still be considered for referral to palliative care.
Okay, so maybe as soon as they find out, and then that is impacting their life. That's good to know because I think there's a lot of misconceptions about this type of care. So you mentioned that you can be patients can be getting treatment for their problem, but they can be receiving this kind of care as well. Explain how that works together.
Yeah, I think where the misconception often comes from is your first question was, how is it different from hospice care? And often whenever patients enroll in hospice care, it's because either they no longer want to receive aggressive treatments for whatever condition they have, or their condition has gotten worse despite the best treatments we have, right? And then so they're no longer on aggressive treatment, and that's when they go to hospice care. Palliative care is different. I can do symptom control for a patient while they're getting chemo, while they're getting radiation, while they're going to cardiac rehab or getting considered for a heart procedure. So I typically do that alongside their other subspecialists, and I try to coordinate really well with their subspecialists so that we're all on the same page and making sure that the patient has a care plan that is really going to help them to have the best life.
And you mentioned that you not only treat the patient, but you treat the family and caregivers. Tell us how you help family and caregivers.
Yeah, goodness. Whenever you have somebody that you care about that's sick, I feel like it turns your whole world upside down. Just through my children or family members, I've had people that I really care about who are sick. And I think I was much more stressed about it than they were at a lot of moments, So the family and the caregivers are carrying a lot of the burden, and a lot of that comes through uncertainty. They don't know what lies ahead, or they might not feel equipped to help the patient if they're having either like an attack of symptoms or if something goes poorly. So all those things lead to a lot of caregiver stress. So whenever we sit down and take the time to explore with these caregivers what it is that I ask people, like, what do you think about when you're in the shower? What keeps you up at night? And then we can get to the bottom of some of those issues and help them understand the disease that we're dealing with, understand the treatment options, and understand what we can do to manage either flares or symptom attacks, things like that. Then they can feel more equipped and more at ease whenever they're helping their loved one.
Right. I'm sure that's very valuable to them. So what does a typical palliative care visit look like?
So we have a great team. I'm sure I can talk more about them later, but I do full-time consults in the hospital. So I see patients who are hospitalized either on the hospital side or in the ICU. And our nurse practitioner, Stephanie DeRocher, sees patients who are in the clinic. So she has clinic appointments available Monday through Friday. Typically a visit, honestly, our first visit just looks like getting to know the patient and the family, because we can do a chart check, but so much about a patient and their situation has to come from the patient. So we get to know people and what they're worried about, what they're experiencing, and then we can figure out how we can be most helpful. If it's a symptom management problem, usually we can promptly address that to try to get them more comfortable. But if it's, for instance, if they need more supplies at home or more caregiver support at home through maybe community resources, we can help connect them with that too.
I'm sure that's much needed as well. How does palliative care improve a patient's quality of life?
There are actually studies that give us cut and dry answers to this, which is nice, because I could say everything I think it helps with, but it's nice to have some evidence to back us up. So we know whenever patients are supported by palliative care as, one of their subspecialists, that they go to the emergency room less often than they would if they didn't have palliative care involved in their case. And they just spend less total time in the hospital. Because when we control patient symptoms well, and whenever they know more about their disease and are making the best decisions for their disease, then we can avoid either flares or things that would put them back in the hospital.
Yeah, and nobody wants to be in the emergency department or in the hospital, that's for sure. So what role does communication play in the palliative care realm?
When it comes to patients and caregivers understanding the disease and really understanding the risks and benefits of any treatment options they're deciding between, communication has to be excellent, because we can't let misunderstandings get in the way of doing what's best for the patient. So a lot of the training we receive in palliative care has to do with communication, because I think, for anyone who's been trained in medicine, we learn this whole other language, right? Which is great for whenever we're documenting things in the chart. But sometimes if we speak in that same language when we're talking to patients, they don't understand anything that we're talking about. And then we end up, without meaning to, leaving them in the dark on what's going on with their body and with their health. And then they're kind of overwhelmed and confused. So really communicating, like us taking the time to understand where the patient and family are coming from, but also making sure that any medical information is relayed in a way that they can understand it and they can be in charge of their medical care.
That makes so much difference.
It does.
I mean, being able to understand what's happening, and I'm sure you ask a lot of questions and want to know what the patient's wishes are and help them and their family carry out what their wishes are.
Absolutely. Yeah.
How does palliative care help patients to navigate complex medical conditions?
Things get really overwhelming whenever we come to decision points about treatments, what to do or not to do, because any potential procedure or treatment does come with some risk, and it comes with some benefit that we're hoping for. And I might make a different decision on a treatment than you would make, right? So in order for them to make the right decision, it really helps whenever we can explore together what they're hoping to achieve, because they're the expert on them and what they want out of life in whatever time any of us have here, they're the expert on that. But, we're the medical experts on what typically happens with these procedures, and we have experience with seeing them. So based on what a patient says is important to them, I can provide a recommendation for which treatment is most likely to help them get there.
You mentioned about your team. So can you tell us more about how the team is structured and how they get involved with a patient's care?
Absolutely. So our palliative care team includes myself, and I mentioned Stephanie DeRocher, who's our nurse practitioner in clinic. We also have 3 palliative care nurses, so 2 on the inpatient side and 1 in the clinic. They are excellent at spending time with our families, making sure they go through things like medication lists so we don't have patients that are on medications for no reason, or making sure that patients and families really understand what those medications are doing. And they'll also spend time providing emotional support or helping answer some of the questions that patients and families have accumulated over time. Then we have a chaplain full-time here at the hospital. So he's a member of our team because whenever someone's going through a life-altering illness, of course, that affects them not only physically, but also emotionally, spiritually, on so many levels. So our chaplain also helps with patient support. And a lot of facilities have a social worker on their palliative care team that can help with connecting patients with resources and even providing counseling in-house sometimes.
And do you all provide outpatient visits?
Yeah, absolutely. So Monday through Friday, we see patients in clinic, and those clinic visits are really helpful to stay on top of symptoms before they get so bad that you would have to come to the hospital or go to the emergency room. So we can adjust medications from clinic and check in and see how things are going at home.
Oh, that makes it so much easier too. So what is the biggest misconception you think people have about palliative care, and what do you hear most often about what people really think and what really is the truth?
I think you got to the heart of it with the first question, just that I think people conflate it with hospice, and they think that we're either hospice care or that we're trying to like pipeline people to hospice care. I think sometimes people worry that we have like an agenda or something, and I don't. Like, my only agenda is to help a patient live as well as possible for as long as possible. That's what I tell my patients. Also, people get intimidated by having like the idea of another appointment to go to, which I understand. Nobody wants to go to appointments, but sometimes by making one change, it can actually make a lot of things more manageable. So if we can help you feel better and feel more on top of your condition overall, I think even though it is an extra appointment to go to, it can really smooth out the road ahead.
Right, very beneficial. Well, thank you for helping people get their quality of life, the best, most quality life that they can have, while they're here.
Yeah, I love getting to work with our patients. It's such a gift.
Thanks for sharing all this information with us today.
Absolutely.
For more information about palliative care and Dr. St. Cyr, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcast. Thanks for joining us.